evening and welcome members of the Dallas Chamber of Commerce. We are ChuckyCheese and we present to you Chucky Checkups. I'd like to take a moment to introduce our team. My name is Cormier Osteen. I'm the Director of Marketing.
I'm Abby Monroe and I'm the Data Analyst.
I'm Mark Lundy and I'm the Director of Finance.
I'm Ananya Malik. I'm Assessments Coordinator.
And I'm Claire Moore. I'm the Head of Event Marketing Management.
On the agenda tonight, we would like to discuss with you a social cause in the Dallas Public School District that needs to be addressed, as well as how we plan to resolve this issue, as well as how you, the Dallas Chamber of Commerce, will benefit by investing into our pilot program called Chucky Checkups. Measles, mumps, rubella, polio, varicella. These are all painful, crippling, and potentially deadly viruses that affect young children, and they can all be prevented with a single shot. Yet, an alarming rate of our children in the Dallas public school system have not received these shots. Dallas County has a high rate of unvaccinated children. We figured that reasons for this low vaccination contributes to three factors: limited and unreliable transportation, lack of education, as well as convenience. Now, Dallas County offers several locations that already offer free or discounted vaccinations for children. However, most of their hours of operation are inconvenient for working parents. Most of these hours of operations are between the hours of 8 a.m. and 5 p.m. Monday through Friday. So by a show of hands, how many of you in the audience have children? Okay, keep your hands up. Out of you that have children, how many of you work a full-time job? So pretty much all of you. And what's your name? Alyssa? Alyssa, if you don't mind me asking, what hours do you work?
Every day I have two jobs.
What hours do you work in your job?
8 to 5, and then I serve at night.
So Alyssa,
on the weekends too.
thank you. So Alyssa works two jobs. She works 8 to 5, and she also has a night job that she works. So apparently, trying to go to some of these free locations to offer these services, she cannot benefit from. She either has to take off from work or leave work early and utilize her sick time, vacation, or PTO to do that, which is inconvenient for her. And most adults may not have that benefit to use. So this is why that we feel our program is very beneficial for the community. Next up, we have Abby, our data analyst, and she's going to discuss with y'all where in Dallas County Chucky Checkups can be best utilized.
Thank you, Cormier. So we will be starting Chucky Checkups at the lowest vaccinated rates school, which is actually Village Tech Schools. They have less than 73% of their kindergarten class vaccinated. That leaves over 27% of those kindergartners unvaccinated and subject to weakened immune systems, illnesses, diseases, and some even death. So our goal is to vaccinate the remaining of the 27%, and we will be giving them 4 shots at our event, which is polio, MMR, varicella, and DTaP. So we will be hosting our event during Meet the Teacher Night, which is strictly for the incoming kindergarten class. And we will have an interactive fair where we will be able to have booths. They will be able to learn about healthy snacks. They will be able to learn about healthy alternatives. And then we will also be administering these 4 shots. So if y'all are able to watch, pay attention to the screen for this video, which is by the CDC. shots, and we'll be able to help with 4 of them. And also at our school, or at our event, we're going to be offering door prizes, and we're going to be offering a raffle. And so in our door prizes, we're actually going to be giving out some of these ChuckyCheese ears. Now I'll be passing it on to Claire, who's the event management coordinator.
Thank you, Abby. I'm going to get started telling you about our plan. So we're hosting a health fair at Village Tech School in their gymnasium on the Meet the Teacher kindergarten orientation night. This is a come and go event from about 3 in the afternoon after school lets out until 8:30 in the evening. So any parents who are coming and going between 2 jobs or after their job before they go in for an evening job are able to bring their kindergartners and get them enrolled. They're meeting their teachers. And what is special about our event that we're throwing is Chucky checkups. So they're entering the gymnasium, they're going to find a registration table, and they're able to sign themselves up, get some of our information, and we're able to find out then from the parents if their child, these 5 and 6-year-old entering kindergartners, have been vaccinated. So based on the estimations, we're thinking that about 20 of these kindergartners have not had their shots yet, and we're hoping to capture those 20 and make sure that they're getting those vaccinations that night. So as some of the parents and children go around the booths, we're able to take by number some of those 20 children and take them into the nurse's office, where we have volunteers from our partner Children's Health giving vaccinations in a safe and healthy environment. And a lot of what's going on in the gym are booths. So we have booths that share information with adults and children about healthy snacks, how to pack healthy lunches, and we have balanced foods, exercise, hand washing, disease prevention. These booths are unique for our families in the school because we have an adult volunteer who's talking to the adults at an adult level, telling you how to take care of your kindergartner and other children at home. But we also have volunteers who are playfully helping the children and understanding how to wash their hands and having games and prizes to tell them about fun snacks and why this is important. So we have 2 different levels because we have 2 different understanding levels. We are getting volunteers from ChuckyCheese. We have a very involved volunteer community within our company, and they are going to be facilitating some of these events. We have all these booths that we're going to be designing, decorations, and we're designing the walking flow around the gym. Here is our idea of the gym. So you're entering and you're seeing the sign-in booth. You walk around and there's all these booths for information. There's some games held in the middle. Along the side there is a video for other parents to see if they're unable to walk around. There's the raffle table where we're raising money for the Village Tech PTA by offering 3 birthday party packages from ChuckyCheese. Every family is going to want to be part of those and hopefully raise more money for the school that we're helping. And then additional seating while they wait to go to the nurse's office nearby. I'm going to be passing off the talk to Anon Emily, and she's going to talk about our success measures.
Hi everybody. There is no such thing as a good event if it's not successful, and we are measuring our success on 2 levels, micro and macro. When we say micro, we mean things that are smaller and easier to measure in one evening. So that's something as easy as attendance, how many people came to our event over the course of the night, how many people got vaccinated, and how many actually gave out. And then we're also going to be checking for enjoyment. How much did parents and students enjoy our event? Did they feel it was a good use of their time? And how much did they learn? Did they feel that they got something out of it? Did they feel that they're now more capable of taking care of their children and preventing disease this upcoming flu season? We're also talking about macro level success metrics, which are a little bit harder to measure only because they're broader and because they take more time to come to fruition. Over this upcoming school year, we're going to watch our kindergarten cohort's attendance statistics very closely. We're hoping to see a higher rate of attendance, especially like lower rates of sick leave for this kindergarten class as compared to 3 cohorts that came before it. We're also going to be comparing their attendance to the other grades in the school. Are kindergarten kids missing less school than the 4th graders? Are they missing less than 6th graders? We're trying to see if these vaccines boosted overall attendance rates within the school itself. We're also going to be looking at the end of the year at the school's overall vaccination rate. How much did we change the school's vaccination rate, and how much did that impact our overall event? Like how many of our vaccines actually made an impact on this school's life. Finally, we're going to be looking at the rankings for the overall Dallas County school systems. Did the school's rankings change because of our event? Did our vaccines change their rankings? Are they now better than are they better than they were this year? Those are going to take a little bit more time to check because it's a process, but we hope to see more success, and we hope to see more students attending school. Now, they say it takes a village to raise a child, but it definitely takes a village to get one vaccinated. We have staffing pulled from 3 different areas, from ChuckyCheese, from the PTA, and from Children's Health, our nonprofit partner. So ChuckyCheese, we're going to be responsible for staffing booths, giving out prizes, and of course it's not a party without Chucky himself. The PTA is going to welcome people to the event, and they're going to guide traffic, and they're going to make sure that all the children are able to fully take part in the event because they're already part of the school community and they know everybody there. They're going to be a welcoming face for any nervous kids. Finally, because we take medical safety very, very seriously, the only people handling vaccinations this evening are going to be licensed professionals from Children's Health. They are going to be giving out the vaccinations, they're going to be talking about disease control, and they're the only ones who are ever going to do anything even vaguely related to medicine. The rest of us are just going to be there to educate and to help the children and the parents have a good time. Now I'm going to hand it over to Mark. He's going to talk about the budget for this event.
Thank you, Ananya. So as you can see by the numbers behind me, there's a very large number and then a lot of very small numbers. We are focusing on this large number because our focus is not only for the kids to have fun, it is mainly for these children who otherwise would not be vaccinated to get these vaccinations. And so our main focus is on making sure that we have all the vaccines we have available, and according to the CDC, 5,460 is about where we would be for 20 vaccines, 20 of each 4 vaccines that we'll be administering that night. Otherwise, we just have some decorations, insurance for the event, some little prizes to hand out, that kind of thing. It's minimal compared to the price of the vaccines. So how does this fit into the Dallas Chamber of Commerce and their mission statement? Well, I mean, we're only vaccinating 20 kids, right? Those 20 kids, is it really going to make that much of a difference? Well, it actually could. The Chamber of Commerce, one of their goals is to see that our current scholars grow up to be successful scholars and successful business people within the future in Dallas. So on a smaller level, for these children, this gives them the opportunity to not miss classes, to stay in class, to learn how to learn in those formative years of kindergarten and first grade. And on the bigger scale, it also means that the baseline vaccination percentage of Dallas County as a whole goes up because we're targeting the lowest vaccination rate school in Dallas County. When we raise that level, the average goes up. If we capture all 20 students, the average goes up about 0.75%, which is massive considering the amount of students that we have in Dallas. That means that Dallas becomes it looks better for people who are considering moving to Dallas or other cities for a career or job opportunity. This actually lends itself to the Dallas Chamber of Commerce's goal of creating a better business environment and growing business within the Dallas community. So that's where this pilot to a project actually fits in on both a small level and a big level for the Dallas Chamber of Commerce. So our overall goal is to improve DFW as a whole with your help, and for that we are asking about half of the price, which is about $3,000 of the $6,100 total that we will need for this event. So our next step is to analyze the metrics like Ananya was talking about. It's going to take time because those macro metrics are really what's going to tell us on a larger scale whether this pilot to a program is worth it. So provided those are worth it, the pilot is worth it, we will consider moving forward to a program, and hopefully with your help we can make this happen. that's our presentation. Are there any questions? Yes?
So it seems like DFW is already trying to fix a problem. How is your company different than the other ones?
So you're asking how what we're doing is different than what's
Yeah.
already happening within Dallas?
Yeah.
I'm going to go ahead and delegate that to Ananya to answer that.
The difference is all of the other programs happen during work hours and they happen at the Dallas County Health offices. That can be hard to reach if you're a working parent or if you just have other things going on in your life. What makes our program different is we come to you, we come to the kids. So we want to make sure that every student has access to good health care, and by coming to back to school night, we're trying to make it as easy and pain-free and painless as possible for all of our kids in our community.
Thank you.
So unfortunately, that's all the time that we have right now. I see a couple hands raised, so please come talk to us. We're going to be in row 4 over here. So come talk to us about your questions. We'd be happy to answer those for you.